Are you wondering what the salary is like as a clinic nurse? Or if you still have to clean bodily fluids as a clinic nurse, what are the differences between acute care nursing and ambulatory care nursing? I have worked in both settings, and today I will be giving you 10 differences between ambulatory care and acute care, and also I will be including bonus information on salary as a clinic nurse. So keep on watching. Difference number one, the acuity of the patient is completely different. So in an acute care setting, which is the hospital setting, the patient has a higher level of acuity. That means they are more sick. Of course, we need to be prepared in a clinic to help those patients that do come in with those critical symptoms, but we do not treat them in the clinical setting. So we have to transfer them to the ER to get that higher level of care that they need. Difference number two, clinic nurses are definitely multitaskers, and that is not to say that the bedside nurse is not a multitasker, because yes, you are. So the difference I mean is that in a clinic setting, you are not only providing direct patient care, but you are also doing telephone call follow-ups. You are also reviewing emails that patients are sending you with their questions. So that's what I mean by the multitasking in the clinic. So difference number three, definitely in a clinic setting, there needs to be clinical thinking skills, because the clinical judgment that you are providing for that patient in order to provide the care that they need is essential. Technically, there is so much more autonomy. There is so much more autonomy working in a clinic setting, because you, as the nurse, are responsible for figuring out whether that patient needs to be seen that day, or hey, let's just schedule you an appointment because it's not something that needs immediate attention at this time. So having that clinical judgment, that critical thinking skills, and being comfortable in telling a patient, hey, you're gonna be okay. These are the things you need to do to help your symptoms get better. But in the meantime, you really don't need to see a provider. So let's schedule you an appointment. Another difference is that when you're working in the clinic setting, you definitely build that nurse-patient relationship with them, because you're continuing their care throughout all the time that they're there, because they're seeing their primary care physician. So you build a lot of trust with the patient, and trust is very important, because if they don't trust you, it's very hard to even try to educate the patient on what it is that they should be doing in order to help themselves improve their lives. In an acute care setting at the bedside, you don't really have time to get to know your patients. You're just doing task, and you're not really getting that one-on-one, because you have so many things to do and you need to get them done by a certain time frame. And in a clinic, it's more that continuation of care that you're getting throughout the years. In a clinic setting, the nurse is responsible for a lot of preventative care education. And that is not saying that bedside nurses do not provide education. It's just that in a clinic setting, you are providing preventative education to the patients with various different diseases. So there's many different topics that the clinic nurse is educating the patient on, while in a acute care setting, the bedside nurse is just providing them the information for that admitting diagnosis. So that is difference number 5. Difference number 6 is that the clinic nurse is not only assessing the patient, but we are assessing the family, the caregiver, and also any unstable environment that they might be in. So we provide resources, so many different resources for the patient, for the family, for the caregiver to have out in the community. The other difference is that in a clinic setting, the physicians are actually in the clinic. So you could just go to them and ask them whatever it is that you need to ask them, and they are there. You don't have to be calling them. Although in my clinic, what we were doing, we were messaging them. So not only were we messaging them, but we were having that direct contact with them every day in order to help our patients. The other difference is that a clinic nurse does not have access to IVs. So in my clinic, keep in mind that every clinic is different. We did not put IVs, so we did not give IV fluids, and we did not have an EKG machine. So if a patient didn't need any of that, we would have to transfer them to the ER. So the most invasive thing that we would do are injections, like any vaccinations that we had to give. Also, like simple wound care, we could also do in the clinic. If not, we would have to refer out to the wound care nurse. Another difference is that the shift hours are completely different than in an acute care setting. So in the clinic setting, it's usually Mondays through Friday, 8 to 4:30. And there are actually some other ambulatory care settings that do open on the weekends and that's funny, and that do work 12-hour shifts as well. I know like some urgent cares, they're open 24 hours, so of course they're probably gonna do 12-hour shifts. In the setting that I was in, we only worked Monday through Friday, 8 to 4:30, holidays off, and weekends off. The other difference is that definitely the physical work in a clinic setting is very minimal, and you're not lifting patients up in the bed. Yeah, you're transporting them, so you're wheeling them out in and out of the clinic or to the ER or wherever they need to go, but the physical work is very minimal in a clinic setting compared to the hospital setting. So that means that, how many times did I clean bodily fluids? I would have to say probably just like once that I could remember in 3 years that I was there in the clinic. I only cleaned bodily fluids once, and that's pretty good because in a hospital setting, you're doing it daily. Now let's get to that bonus information that you probably came here for, and that is salary. Does a clinic nurse actually make less money or more money than a bedside nurse? So I'm here to tell you that I actually made more in the clinic setting than in the hospital setting. So I was actually making about $13,000 more in the clinic setting than what I was making at the bedside. So keep in mind that I do work in California, and that every state is different and every facility is different. So those are 10 differences that I noticed working in an ambulatory care setting and an acute care setting. Completely different environment. Clinic nursing was probably my favorite, and I hope that if you guys are interested in clinic nursing, you guys actually try it out. Try it out for yourself. You might like it, you might hate it. You won't know unless you try. So subscribe for more videos. Like this video if you enjoy the content. Share it to anybody who you think might want to watch this, and I'll talk to you guys soon. Bye.